is about a 10 to 15-minute presentation on the topic. And of course, the topic is a hot topic today. The new recommendations that have just come out from CDC. So let's go to the next slide and we'll talk about this. As if, you know, these changes aren't frustrating enough. Here we go again. Okay. So my best advice is, first thing to do is do not panic. It may take a little time for guidance to align across all entities. You know, CDC will come out with these guidelines and the public thinks that means everybody, employees will think that it means them too in healthcare settings, but as we know from past experience, that is not the case. So you have to look at where to get the information that you need in order to really be able to understand these guidelines. They are guidelines. Remember, the pandemic is not over, regardless of what President Biden might have mentioned a few weeks ago on TV. It's like, no, it's not over. We still have high transmission rates in many, many counties. And I think on Tuesday, if I remember correctly, Carrie looked it up, and or Shannon might have been the one who looked it up, but 14 counties in New Mexico still have very high transmission rates. So what does that mean for you? Well, they may come out with all these loose guidelines of saying, you know, no masks and no screening and no, you know, not doing any of the things that we finally got staff to do during the pandemic. But your responsibility is to keep your residents safe and your patients safe. So whatever you have been doing, I would suggest you not rush to make changes. If you get surveyed, if you're a facility that gets surveyed on an annual basis when the surveyors come in, if you have a high transmission rate and you're not protecting your vulnerable patients or resident populations with masking, you could get a tag for that. You could get a citation for that. So be careful, be patient. Some health departments in some states are coming out with technical bulletins. I don't believe that New Mexico is planning to do that, the last I heard. And Carrie, if that has changed, please let us know. And we know that we're going to get into a big flu season this year as well, based on what has happened in Australia. You know, their seasons are opposite of ours, and they had a very heavy flu season. When we stop wearing masks, people are going to get the flu. In the last couple of years, flu numbers were down because everybody was wearing a mask everywhere they went. So the healthcare, even in community-based settings, such as your home health and hospice settings, are different than other practice settings. So if CDC is saying you don't need to wear masks anymore, I want to just reference 3 paragraphs from a letter that came out from the president of APEC, the Association for Professionals in Infection Control and Epidemiology. Linda Dickey is the current APEC president. And here the letter says, despite CDC's recent guidance shift that relaxes recommendations for universal healthcare personnel masking, APEC strongly urges its 15,000 infection preventionist members to maintain mandatory mask requirement policies for healthcare employees in all patient care settings. On September 23rd, the Centers for Disease Control and Prevention, CDC, updated its interim infection prevention and control recommendations for healthcare personnel during the coronavirus disease 2019 COVID-19 pandemic, lifting universal masking recommendations for healthcare personnel. Instead, CDC suggests that healthcare facilities use its community transmission levels as a guide for when source control is necessary for healthcare personnel. Based on these updates, healthcare facilities in geographic areas with low levels of community spread may relax their employee masking requirements. While APEC understands that many healthcare employees have grown weary of masking, we do not believe it is wise to discontinue this evidence-based COVID-19 mitigation strategy, especially as we enter what is predicted to be a severe flu season with COVID-19 surges looming on the horizon. In addition, there is a 7-day lag in CDC COVID testing data, which may limit the ability to detect surges in real time. The other thing I would just point out to you is we know a lot of people before the program ended got their free COVID testing to test themselves and their family members at home. And those test results are not reported generally to the local health jurisdiction. And I must admit, when I had COVID and tested positive, I did not report it to anybody other than my teammates here. So those cases are not being counted. So be aware of that. So that means the community transmission rate is even higher than what you think it is. Let's go to the next slide. And we know that CMS has come out for nursing homes with all of these new infection prevention FTAGs, they're called. FTAG F80 880, infection prevention and control. F882, the infection preventionist qualifications and role. And we know that these instructions have been in place for a while, that you need to have an infection preventionist identified who works on site at least part-time and has received appropriate education for the job. So that is not really defined very well at this point, although I think that is going to be further defined in the future. But they're saying that if you take the 23 module CDC CMS online infection prevention course, that would count as a good start at least, and would avoid you getting a citation for not being qualified. But those of you who have taken that, and that includes myself, will realize that at the end of taking those 23 modules, you really don't have a good handle on what the job is and what you're expected to do. But it's fundamental, and it's, you know, a good place to start. And we know that you're going to be evaluated when surveyors come into skilled facilities starting later in October, and you will be evaluated based on these FTAGs. Most of these, half of these came about during the pandemic. And beyond these general notes, CMS also provided extended discussion of requirements for facilities to maintain your water management program to prevent the spread of Legionella. So that's really important for IPs to know about, especially if you have water features in your buildings. You must have a plan for how you test that water to protect residents and staff from Legionella. Okay, let's go to the next slide. So lots of changes coming at you all at once, just, you know, kind of a deja vu back to 2 years ago when things were changing on a daily basis. Things aren't changing that quickly, but they are coming out with new guidance that you have to be very careful about. Requirements for facilities to implement appropriate transmission-based precautions in the event of a constellation of new symptoms among residents, which may signify a communicable disease. Finally, CMS also included guidance under F880 on addressing the multi-drug resistant organisms, one of which, the one that is really a problem in Nevada right now, is C. auris. And I don't know if New Mexico is having the issue, as severe an issue as Southern Nevada is, but C. auris is not just another fungal infection. C. auris is a deadly multi-drug resistant organism. And we'll be talking about that in more detail in a future class, because you do need to be aware of that. And then for F882, CMS outlined several key requirements for facilities required infection preventionists. And as I said, the hours, the qualifications, and specialized training. Next slide. And what about other health settings? Because we understand that not all of you work in a skilled nursing setting, but you work in a variety of long-term care settings. And also for the home health and hospice people, you all go into your patients' homes, and every situation can be very, very different from the previous one. And we do recognize that. I was a home health nurse and hospice nurse practitioner, so I know what those settings can be like, and they can be challenging. Okay, so you're not required in these other settings, such as assisted living, group homes, adult daycare, you don't have to implement the new CMS guidelines. They're considered best practices and they are evidence-based. So if you want to enhance your program and have the best possible infection prevention program, look at some of these CMS guidelines and adopt them for your own facilities. Whether there's a regulation or not, it can still impact the outcomes of your residents by reducing or mitigating the risk of infection. And we know that the public is looking very closely at all long-term care settings because they have very high expectations of all of you, especially since so many individuals
enter your security code.
Got COVID and several.
You have 13 new messages and no saved messages.
Oh, Todd, you're not muted. There you go. Thank you. We know that a lot of people died from COVID who were in these congregate living settings. So we have to be very sensitive to that. Implementation of a solid infection prevention and control program with your policies and procedures. If you get your hands on a copy of the State Operations Manual, which comes out from CMS, it is available to everyone online. They have the new changes in there, and in red ink, it's a very long document. It's like 750 something pages, but if you go to the latter part of the document where it talks about infection prevention, in red, it will tell you exactly what you need to do to meet the intent of those standards, those new F tags. Quality improvement measures can also serve as positive messaging to the community about what efforts you're making. If you're going over and above what is required by doing an infection prevention program, you should get that information out to your community and let people know that you're going that extra mile. All right, so let's go to the next slide. And I see Carrie has a comment here. She says, Carrie, you want to come off mute and mention this? This is very important.
Sure. So New Mexico pushes out a health alert advisory notice. It's called the HAN, which you're able to sign up for. If you just put in New Mexico HAN, you'll get the sign up for this. But they sent this out on the 3rd of October, letting us know that we have had our first clinical case of Candida auris, and it was in an adult with multiple hospital and skilled nursing facility admissions. So, you know, it's definitely, you know, this is the first one we've seen that's a clinical case, so that probably means it's the tip of the iceberg. But I think it's really important to recognize that it wasn't someone who just came into an acute care, that they had been in multiple facilities. And so, yeah, it's something to definitely be on the lookout for, regardless of your setting.
Yes, thank you for that. And I'll tell you, the nightmare in Southern Nevada has been, they've had such a problem with CRS outbreaks that they actually brought the experts in from CDC to help with education, and they put on a very fine presentation for all of the facilities in Nevada. So we'll be taking some of that information and sharing it with all of you as well, because there's much to know and you need to be prepared. Okay, so now we come to the section that's the roundtable discussion.